One very popular lens that we use is called a light adjustable lens. This is a very unique technology, and it especially applies to patients who have either had prior surgery in their eyes, like LASIK, or for one reason or another want to have us be able to really fine tune the sharp focus of their eyes. Typically, this lens is used for clear distance vision, and sometimes we make the two eyes slightly different to achieve a greater range of vision than one lens alone could achieve. Part of the discussion that we'll have when we're talking about surgery is what might be appropriate for you. But what's really remarkable about the light adjustable lens is we can go in with one plan and then slightly change that plan after surgery. What makes the light adjustable lens light adjustable is that we can actually adjust the power of the implant after it's in your eye. And that's a remarkable capability. The way it works is we implant the lens and do the surgery just like with any other lens. Then after surgery, we allow your eye to heal for a few weeks. You come into the office, we dilate the pupils and do measurements of the eyes just like we do for glasses, and then program that glasses prescription into a machine that shines light on the lens, UV light, that will alter the power of the lens implant inside the eye. And then a week later, we bring you back and we can do it again. And we can do that adjustment a third time. Then finally, when all of the adjustments are done, we lock it in with 2 more visits to make it permanent. So for patients who think they would like to try having one eye slightly different from the other to achieve a greater range of vision, this allows us to try it before we make it completely permanent. For patients who've had prior surgery or some other disease of their eyes that makes it less certain what lens implant they need, this allows us to adjust it after surgery so we can be much more confident of achieving the type of result that you want and that you deserve. And for patients who really want to have a precise result of surgery because of their occupational or other desires to see extremely well, this lens can achieve what really no other lens can because we can adjust it after surgery. Regardless of what type of lens implant you choose with surgery, we're going to do our very best to give you the very best vision that we can. Please realize that with surgery, we can never make guarantees for the result that you'll have, whether you'll need glasses for one activity or another. That depends upon individual factors, it depends upon healing, and this is a medical procedure. Also remember that surgery is a major event for your eye, and it really takes a year for you to fully see the way that you're going to see afterwards. Things like inflammation and dry eye and the effect of the eye drops can take many months to wear off after surgery. I often tell folks that if you went through knee surgery, you wouldn't expect to run a marathon the next day. Similarly, with eye surgery, it's going to take time for you to have stable vision that you can count on. Having said that, the vision that you get after surgery, we hope is going to be much better than what you had before, and you'll be very satisfied with the procedure that we